Hi, I'm Amber, and welcome to the Lone Star Keto podcast. Today we have a special guest. Her name is Austin Cavelli, a medical name, and she is a physician assistant and a dietary consult. Welcome, Austin.
Thank you so much for having me. I'm happy to be here.
Absolutely. I love your name, because, I live next to Austin, so I think it's just so cool.
Thank you. I know it's either
Great name.
I get, oh, I love your name. Other people, it's like, oh, I was expecting a guy. So I get
That's
it.
interesting. Huh.
Yeah, all the time.
Okay, so let's start out. You are a physician assistant.
Yes.
Would you tell me what exactly is a physician assistant and how does that differ from being a doctor? What can you do? What are you not allowed to do?
So technically, as a physician assistant, I have to be like working under a doctor in the sense of like a hospital setting or private practice. So I am an assistant to a physician, but in the sense of what I can do, I basically can do everything that the medical doctor can in the sense of diagnosis, treatment, writing prescriptions, getting radiograph, like x-rays, imaging. So pretty much, yeah, it's just a little less liability, which is always a good thing in the medical field. And then as far as I actually, where I went to school was at Cornell in New York City, and it was a surgical program as well. So I've had experience in the operating room as well,
Wow.
working, being able to close incisions. So the spectrum is wide for physician assistants, and it's less schooling. It doesn't require the residency and fellowship that the MD does. So a little bit more flexible in the sense of days. You usually do 3 or 4 days a week, like 12-hour, 15-hour shifts. So yeah, that's the big gist of it, I'd say.
Nice. And I'll tell you a little secret. I've actually had more success with physician assistants than the doctors. I'm just saying. That may just be my experience, but
Oftentimes
yeah.
we have more time to spend with patients. And so, especially in a private practice setting, we're the ones who really do the kind of the most of the consultations, like one-on-one with the patient. And then the doctor comes in kind of at the end, says, yep, I agree, good to go. So a lot of times the patients are like, oh, where's Austin? Because I'm not used to dealing with you for that long a period of time, and in the sense of the doctor themselves. So we
Yeah,
do that.
I always got I specifically would ask for the physician assistant. That's who you normally got anyway. That's
Yeah.
just what was available if you didn't have an appointment way ahead of time.
Right.
And then they would say, oh, you're in luck. You actually get to see my doctor. And I was like, oh, okay, yay.
I was kind of looking to, finish up the combo I had last time with the PA.
Not that I didn't like my doctor. I shouldn't. I
Yeah.
did like my doctor very much. He's retired now, but I did like my doctor. But I
Yeah.
really liked the PA. But
Yeah, no,
she moved on to bigger and better anyway, and she moved into Austin instead of Round Rock.
okay.
So that was sad. So we lost her before we lost
No.
our doctor. Now I have nobody, so I'm just not going. And so
No.
whatever. I'm just going to go to the little minor whatever if something happens. But
Yeah,
whatever.
like
Yeah,
the
I'll get
emergency
my own
clinic.
tests done. I just went through and did a whole battery of tests just to see where I was, my
Yeah.
cholesterol, A1C, vitamin levels, all that kind of stuff. And it
Oh,
was all
awesome.
just dead on, except for cortisol. I need to work on that. So
Okay.
cortisol was
Maybe some
yeah.
sleep issues
I
or
don't, well, I just, I had an Aura ring, but I'm charging it now. But according to that, I'm getting fine sleep. So
okay.
I don't know. I think it's stress, whatever. It's a
Yeah.
situation. Yeah. But
Right. It
I'm, I'm,
could have
I'm
been the
working on it.
week.
Yeah. It's like, oh, I need to do,
I know,
or
right?
however you do it. I'm so good at it. I don't even know how you do that. So. Okay, so let's go ahead and talk about your health background. Like, I know you had some kind of issues going on,
Yes,
and it kind of led you to carnivore, I'm assuming. And
absolutely.
now you have this passion for carnivore.
Yes,
So
for
explain
sure.
all that so we can kind of know why.
Yeah, so I always had digestive issues growing up, and my family, in an Italian family, that is a hard thing to to have because I grew up where, if you ate what was on your plate, you were getting seconds or thirds because it was kind of rude not to leave left. Like we didn't have leftovers. My dad was one of six, so him growing up, it was like eat, 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 get your seconds while you can get them. So he kind of also had that within our family, carrying those habits over. And yeah, so it was, we're going to finish the meal because mom and dad spent time cooking it. And some things just did not agree with me, yet I continued to eat them out of respect. Particularly lactose intolerant, not good as far as Italians and cheese. So that was a big one. And then over time, it really became more noticeable with vegetables. And that was really probably closer to my late teens, early 20s. I was seeing, the gastroenterologist, getting endoscopies where they look down into your stomach, getting colonoscopies as well. It was because of a lot of the fiber, and fiber was actually worse for me in the sense of constipation and just overall movement, digestion. So I was having, bloody stools as well. So I had colonoscopies, 3 and 4 of these by the time I was in my mid to late 20s, which just isn't normal. But every time they would say, oh, a little inflammation looks okay. And little inflammation, it's like, there shouldn't be inflammation. I should be good to go, like what's going on. So that was always weird to me. And then they would pass it off as, it's not that bad compared to what? Compared to someone who has, hemorrhoids or lesions that have colon cancer. Like, what are we comparing it to? So the answers were never great. So I took it kind of into my own hands. My brother had moved out at the time to Portland, Oregon, where paleo was like, hey, this is a new thing. This is a trend. So we were just like, hey, let's try it. And paleo does not include dairy. So it was like, oh, easy. I can, that's my thing. Like I can cut that out completely and see where it gets me. So that's kind of how I started whole foods, paleo, transition to keto, transition to carnivore. Less fiber was definitely better as I went from each one. Namely the cruciferous vegetables. Oh my goodness, those were the absolute worst. So your broccolis, your Brussels, cauliflower, which keto is heavy on cauliflower for making that the substitution for anything grain. So then once I went carnivore, it was like, amen, hallelujah. Plant sources being out completely. I've never been more regular. I really have no digestive issues at this time.
I hear you. I was in the same boat. That was the thing that kind of shocked me because when I went to keto, I thought, oh, this is great. I don't have as much constipation. I don't have as much gas. This must be what normal is. I don't have the bloating. I don't have all this. And then the first couple of days on carnivore, I was like, what the heck?
Absolutely.
This is awesome. I didn't have a clue what real good digestion was. So I'm with you there.
No, finding like the new normal. It's just this aha moment. And you're like, wow.
It's sad. It is sad. Do you find this a lot in your patients?
Yeah, but I will say with the social media around these diets, they're expecting it sooner than, for me, it was a couple days you've noticed things, but weeks you were just like, yes, this is now the regular. And you do have to go through that transition period. So now I feel like just us being Americans want it quick, ASAP. And if it's not happening in 3 days of starting carnivore, they're like, what is going on? Like, or they have the diarrhea that is pretty typical with having no fiber and regulating. They're like, oh my God, it's not working for me. So I do have to, kind of give them that timeline that you have to have the sense of years and years not eating optimally, and then you can't expect it overnight. So, but
That's really funny because last night I was talking to Judy Cho about this very thing, where she was saying that because of all the hype around it, which, I do a lot of the success stories for Meet RX.
Oh, yeah.
And in a way, I mean, it is a miracle for a lot of people, yes, but it doesn't mean every single person is going to get those results like that and going to have the same results. And so people go to it like what you're saying, and they're like, wait a minute, this did not clear up right away. This is not so miracle-like, So
especially the weight loss.
Yeah. Yeah.
And a lot of times people are coming from a ketogenic diet to carnivore. So as far as like the water weight of carbs, it's not going to be that big whoosh that they're expecting. So I do like to kind of shed light on that as well, that if you're going, if you're going from standard American to carnivore, yes, you may see it more quickly, but also, women, hormone regulation, it all takes time. So the hype around it is, again, that kind of quick fix. And you just have to keep in mind that it's been, I always ask, how old are you? Well, I'm in my 50s or 60s. It's like, okay, 50s and 60 years of standard American carnivore, let's, we gotta give it a little time.
Yeah. That's interesting. Yeah. And I think, and that's probably why a lot of people just consider it to be a fad, because it's just like the next, quick promise kind of thing, like, oh, do this and all your ails will be gone. Take this snake oil kind of thing. And people buy into the hype part of it. I mean, people do have real results. I hear it every day. So it is real. It's not necessarily the same for every person or going to happen that quick,
Right.
I mean, it takes a long time to heal it very deep.
And the goals really matter. I mean, if weight loss is the goal, or if you're trying to reduce inflammation in general, like all of those things matter. And where you started from to where you want to get to, it depends on the individual on so many levels. And then, like you said, here you are, your diet is in check, obviously, and then your cortisol is still a little bit high. So like, what else is going on? So I think I also like to frame it. I don't like the D word. Diet is just, it makes me cringe every time. I like to say lifestyle and say, looking at sleep, looking at how people deal with stress.
The holistic.
Exactly. Whole picture.
Yeah.
Sure.
I love that. I think that is so incredibly important. And to be honest with you, I think that was a lot of pieces of the puzzle that I never put together, because I focused only on diet and exercise, because those are the two. And they are very major, yes. But if you don't have all the other stuff in place, guess what? Because I'm having issues with that cortisol, let me just tell you, I'm a pretty strict carnivore. I mean, I allow spices and stuff like that. But I don't have cheat days and stuff like that. I don't do that. But
I hate the word cheat.
Yes,
that's another thing.
My weight has kind of started creeping up, and now my clothes are tight, and I'm like, what the hell? I haven't done anything different.
Yeah.
And then when I got that cortisol report back, but I was thinking maybe I had Hashimoto's or something. I didn't know. Is it just menopause? I don't know. But then the cortisol was like, shoo, and I was like, okay, now I know what I need to work on. Okay.
It really, whole picture is so important.
Okay, so speaking of that, you see patients all the time. How do you approach a patient? Say I came in and I say, my life is so hectic right now. I barely had time to come see you, but I'm having these issues. I'm not sleeping well. I'm gaining weight, but I haven't changed my diet. And my diet was spot on, and I was doing great with it. And then all of a sudden I'm not.
Or they will still, they'll say, but I've been so strict. I've been doing everything right, strict carnivore. And I say, okay, but let's go through. So I definitely I definitely want to know the details of their medical history to start. What's prevalent in your family? What have you been diagnosed with personally? Do you have any previous lab work? to show, just so we have a baseline. What diets have you tried? When did you feel like your best, where you weren't even thinking about your health? Like what was happening at that time and what has changed up until now? So it kind of getting this whole picture, and then also looking, like I said, at their overall lifestyle. So many people will be like, oh yeah, no, I don't know. Like they'll brush over that. I'm like, well, what do you do
Yes.
for movement or activity? Like it doesn't have to be the strenuous gym exercise, but just day to day. So I walk through, what is your typical day? And many people in my experience have incorporated, a morning routine and a nighttime routine, and trying all the biohacking things of no, minimizing blue light and all of that, and just being in that space. And they are like, well, I wake up and then I shower and then I start my day. And I'm like, do you, any practices of gratitude or meditation or any of these things, just for coping with stress or starting your day on the right foot? And no, they're like, then they immediately go to their breakfast. Like, yep, see, I do eggs, I do the steak. Like, so what's wrong with me? So it is, they do focus on the diet, but I like to get the whole thing. So sleep, stress levels, how they cope with it, just overall lifestyle, kind of day to day, morning routine, nighttime routine. Had previously was living in New York City, which personally I think is one of the most, it's a beautiful city, and I don't regret living there, but it is a very toxic environment in the sense of, I mean, even if you're living in an apartment building, how much radiation like you're being exposed to, in the sense of all the Wi-Fi and or the EMFs. I'm sorry, as far as one apartment, how many are surrounding you, things like that you just can't control, and pollution and this and that. So long story short, even things of, are you using plastics? Are you using glass? Like chemical exposure for hormones in your household. What do you use on your body, your biggest organ? As far as your skincare, I do like to look at everything. So people are like, well, the consult, it's going to be at least an hour. What are we going to talk about? I'm like, oh, we have a lot to talk about. It is a whole picture for sure.
I love that. I think that is so incredibly important. And I think that's what so many of us are missing, because it's all about sick care. It's not really about health care. And
Right.
so we just, a Band-Aid to fix whatever your symptoms are, instead of figuring out the root issue and going at it from the bottom up. They're kind of starting, let's just kind of numb this stuff and
No,
go
people
on with
like
your
don't
life.
think about
No,
what quality of water you're drinking, like filtered water, if it has minerals in it, or,
no.
and like I said, the plastics versus glass, or all of these things kind of leaching into.
Whoops. Yeah. Oh,
Like,
I got work to
God.
do too. Yeah, I got work to do. I mean, between the stress and my sleep is pretty good and all, but doing stuff like that, I've kind of worked on some of my skincare. Like
Mhm.
I'm using Fancy Farm, the
Yeah.
tallow skincare. So I'm
Yes, a fancy
real
farm,
happy.
Perma
Yes,
Earth,
yes,
for
I love
sure.
that.
I always,
But
always
I
recommend.
wear makeup. I mean,
Yeah.
I'm in the process of kind of searching out some better, things, but
Yeah.
I'm
Same.
not gonna not wear my
As
makeup.
things run out, I'm like,
Yeah, yeah,
okay,
it
I'm
kind
not
of
going to buy
replace.
that
Yeah,
again. I'm
yeah,
going to not go to Sephora and spend a bajillion dollars every time.
yeah.
I am going to find the safer alternative, and, you know, whether it's soap or shampoo or mascara or, whatever. But
Yeah,
yeah, no, I'm trying, and it's a
yeah, it
journey for
is hard.
everyone.
Yeah,
You know,
and
it's
wherever you look, like you say, you just don't know. I mean, everywhere
no,
you go, and just like when you go out to eat, you don't know what they're cooking in seed oil. You
no.
pretty well know that they're
Yeah.
going to, but even if they tell you no, you're like, or if you ask,
Right.
is that real butter? They're like, well, yeah, it's real butter.
Yeah.
No, I mean like real butter.
Right.
Yeah, it's butter. Oh,
I've
no,
even
they don't
asked
know.
about salt, like what kind of salt is it? It's not
Yes.
obvious that it's, table salt. Are there any additives in it, as far as, the sugar to make it so it's not declumping, that it's not clumping up? And even, the waitress at the time didn't know the difference between sea salt and table
Yep.
salt versus
Yep.
red mint salt. I mean, there was just,
Yep.
I was like, okay, I'm going to have my red mint salt with me at all times.
That's what we do. We have the
Yeah,
little shakers and we
that
just
was
bring that with us.
lesson learned.
It's just easier. I mean,
I know.
I accept the fact that if I go out to eat, which we do once or twice a week, and I get, like either just the burger patties, which are natural burger patties, or a steak, and that's all I get.
Yeah.
But you still don't know what they cooked it
No,
in,
no.
So I accept that fact, but I try to eat really super clean the rest of the time, so it kind of makes up for
Right.
that. And that's kind of what I try to do with some of the external stuff. Like I've started with my skincare, and then, I'm going to try to, but you got your deodorant, you got your makeup,
Oh, I
you got
know.
your hair products,
And you could literally sit on the computer for hours at a time trying to find the cleanest product. It's
Yes.
like deodorant. Don't even get me started. I've
Yeah.
tried.
Yeah.
I don't know what the best answer is, but I'm trying a couple of them out, and it's just like, the fact that you're conscious of that is great.
Yeah.
That it's
Yeah.
next level, that you're trying to take it one step further just for your overall health is important. It's the awareness of it.
Yeah. And I think, every little step forward you make, it's a good thing. So
Right.
the more you weed out, the more your body can probably handle the other crap that you can't weed out. So,
Exactly.
I mean, not saying it's
The
good,
environmental,
but yeah.
no, the environmental things, it's like, there's fires in California, and there's, like I said, in New York City, like there's things you just can't control. It is what it is. So yeah, those types of things is what you can control. You do your best, and that's all you can do.
So did you find yourself more stressed when you were in New York City versus where okay, yeah. I figured so. That feels to me, just watching TV shows in New York, I feel like this.
Yeah, no, your autonomic nervous system is on fire.
Yeah, and it's not like I live out in the country. I live in like the suburbs and near big cities, but yeah, I just couldn't imagine that.
No. And I'm from upstate New York, where it is suburbs. So it's funny, every time I would go home and visit, my dad would be like, oh, listen. I'm like, what? He's like, you hear the birds, you hear nature, because New York is not like that. You don't hear any cabs or sirens or this and that. So yeah, just being in, a city alone, whether it's New York or even a smaller city, there's different levels of stress, different energies that you're just like, oh, wow, this is, when you do go on vacation, you're like, this is less stress. You feel it pretty immediately.
Yeah, that's so crazy. I can imagine that. I mean, and stress is real, people. I used to blow that off, just blow it off. And now I'm kind of seeing it with my own self, and I'm just like, oh, I guess it kind of does matter. Wow. Okay.
Yeah, no, I've recognized, blowing it off, or like just sinking it down deeper in you. Versus confronting it or coping with it in the sense of whether it's meditation or reading a book. Like there are ways to deal with it and then to push it away. And I think just it manifests later in some other form. So yeah, dealing with that and seeing how patients deal with that. I think it's a really, really important part of the puzzle for sure.
Absolutely. Okay, let's talk about bioindividuality. Like, how do you approach patients? Because we're all a little bit different. I mean, we're the same, but we have different issues going on. How do you deal with that? And how important is that to look at each person as being different?
Yeah. So, especially in the sense of the diet, like I said, they'll kind of tell me, it's almost like their badge that they've been strict carnivore. And that is it. I mean, I don't want to downplay it because it's a big step. They feel that this all or nothing approach. It's kind of dogmatic to them, and they feel like they've given up a lot, which is, I give them a lot of credit, especially people with autoimmune conditions. I think it's a great approach to eliminate, to use it as an elimination approach to kind of get a baseline, but it's not always the best approach for everyone. So I think bioindividuality is a it's a big part of my practice, just in the sense of finding out what works for you. And that doesn't have to be strict. For some people, it is a little bit of carbs. For other people, it's incorporating, chicken, pork, not just doing beef. Some people, yeah, like I said, a little bit of plant sources, they're okay with that. They need that kind of more. There's people that are abstainers and moderators. So for sustainability and for lifestyle, there are definitely personalities of moderators where if they having a little bit of everything just makes them more sane, versus other people who are, the people who are carb, that struggle with carb addiction or sugar, like even a little taste of honey sets them off. They would rather abstain from it completely. So I do see that as well as in personalities for bioindividuality. And I definitely keep that in mind. I have a sister who is an all or nothing type, and she has Hashimoto's. We're transitioning now to a low carb approach, and she needs, I'm trying to get her out of the all or nothing mentality so badly, but she's still like, I feel like I'm cheating. I feel like I'm cheating because she's eating things that are sweetened with stevia. But I'm using those as transitions so that she can get away from the addiction of the sugar and the chocolate or the carbs. And she just feels so guilty about it. But for her, this all or nothing approach has never worked. So I'm telling her, like, it's okay. These are healthy options. You're staying away from grains. You're staying away from processed foods. You're introducing just an alternative to get you through. And then you'll see that your taste buds have changed, and you probably won't even want that stevia sweetened fat bomb anymore, So, but if that's what it takes to transition you, that's absolutely, okay. Like, it's not just because you're not strict all or nothing. So yeah, those are a couple of examples. But then also bioindividuality in the sense of their nutrients. So looking at their symptoms, there are certain deficiencies that we're seeing that point to that kind of correlate with symptoms or cravings. So if someone is deficient in something, seeing that even in their labs or with the symptoms, focusing on, okay, well, maybe a better approach for you in the sense of diet would be incorporating this food because it has higher amounts of that in it. So taking it on that level as well in terms of nutrient deficiencies. There's so many things to consider for the individual. And then again, stress and how they deal with it. And some people are, I had a client yesterday who I said, do you have any stress? She said, no. Her approach to life was to wait to worry, is what she told me. And I thought it was great because she said, there's people who they focus on the future or something that hasn't even happened yet. And they're worrying about it already. So I wait to worry. And then when it does happen, or when it's out of, when I do have to make a choice or do something about it, I pray, because it's pretty much out of my hands anyway. It's how it's going to unfold is how it's going to unfold. So for someone like that versus the other person who is high stress all the time, like their approach to diet and approach to lifestyle is going to be different in terms of a plan from a consultation perspective.
Absolutely. Yeah, I do think that's so important because we are all not the same. And, our personalities do affect things.
Yeah.
I mean, I'm one of those people who I don't like just jump into cold water. No, ain't going to happen. I'm going to put my toe in, then my foot, then my leg.
Like
and then,
cold plunge. No thanks.
Yeah. And so the whole, like what you said you're doing with your sister, where I started out keto, doing the whole thing, the desserts, all of that, replicating.
I mean, I was there. Absolutely.
And it just kind of tapered off because I just stopped caring. So by the time I transitioned to carnivore, I had already gotten rid of most of that. And I was really
Yeah.
pretty much just eating meat, maybe not so much red meat, but, because you don't want to eat too much meat, right? Even on
Right.
keto. And vegetables. So there wasn't
Yeah.
really, it wasn't that dramatic of a change for me, honestly.
Right.
But people do have to, work with their own self, but one size
Yeah.
fits all can't fit.
Right.
And
And you have to look at it like, why haven't you gotten there yourself? I mean, especially as a consultant, you're coming to me because you haven't been able to do it yourself. So why haven't you been able to do it yourself? And for my sister, for example, I think it was the fact that it was just this all or nothing. It was, and then she was like also adding on, well, I need to exercise too. And I'm like, we gotta take it slow, because if you make all these changes at one time,
mhm.
you're gonna fall off the wagon much more
Yep, yep.
quickly. It has to be a transition. You have to make it a habit. Like you said, dipping your toe in, you are already a step ahead by eliminating the grains, by eliminating the processed food. So like
Yep.
that, you have to, say good job, like, commend yourself for the fact that you've already taken it one step. And again, it's a journey. Health is a journey. You can be a provider, you could be a PA, you could be a doctor. There's still every single person in this world can make an improvement to some degree, big or small. There's nobody who has health like 110% done. No,
Yeah,
it's
there's
going to be
never
a
a
journey.
finish line. Yeah.
Never,
Yeah.
never. It will be a journey for your entire life.
Yeah. That's what I try to tell like my clients is that, just stop looking at something with a finish line, because
Right.
that's what we've
And the
always.
timeline as
Yeah,
well.
yeah. Just get rid of that. Get rid of that pressure, that stress. Just get rid of that, and let's just focus on one step at a time and get rid of that date. We don't need a date. We don't need a
Yeah.
finish line. We're good,
Yeah,
because this is something that's going to continue. You're going to
absolutely.
change. You have to evolve. That's what I'm learning.
Yeah.
What worked for me a year ago is not working for me right now.
Oh yeah.
So,
Even in carnivore, even
no,
if
yeah,
it's within a niche, like
yes.
your carnivore journey, it evolves. You were eating
Mm.
initially all animals. You may find beef is best, or, oh, I really miss chicken, I'm gonna start incorporating chicken again. Like, it just changes all the time.
It does. And when you're so stuck in dogma,
Oh,
and you identify with that diet lifestyle
yeah.
instead of worrying about what's best for your body, is such a huge
Right.
mistake, but I see it all the time. And
Yeah.
it's like, and I probably was that person, to be honest with you. But after seeing so much of it, I started questioning. I'm like, this is kind of dumb. What
Yeah,
difference does it make
exactly.
if you have a different version? Does
Right.
that not make you a carnivore? Does that not make you keto? Does that, whatever it is?
Right. The
If
identity with diet is definitely something
mm,
that is just really prominent right now in
yeah,
social media and just everywhere. And it's great, that we have people leading the community, and they're quote unquote the experts in the space, as far as continuing to lead through with the research. And I think that's important. Just
mhm.
from a science background, I think we want to learn more, obviously, but I think people are becoming obsessed with the best way to do it. And the best way to do it, even though, like, yes, we're learning the science, but the best way to do it is the way that really works for you.
Yes.
Um, Even if the science, says something different, it has to work for you. It has to be a lifestyle.
It has to
So
be sustainable.
exactly.
If you're not going to stick with it, what the heck's the point? I mean,
Right.
you
Because,
know,
no offense, but science has steered us wrong, or what science has said for
yeah.
all of this time up until now, that we're actually now seeing, low carb and keto and new science. So we
And it
can't,
changes. It
yeah,
changes. There's more information, there's more research, there's more
absolutely.
antidotes. I mean, things change, and you have to be
Absolutely.
willing to evolve with it. And,
Right.
I'm learning that lesson.
No,
So,
I'm with you. I am with you. For
Okay. So,
sure.
as a physician's assistant,
Mhm.
what kind of issues do you see the most often when a patient comes in? Why are they coming in? What are you seeing?
Yeah, so as far as the spectrum, it's pretty wide. It can be from people who are just starting, who are coming from standard American, to autoimmune conditions. And overall, it's this many clients say to me, which is kind of heartwarming. I want to reduce inflammation. I want to
Oh,
optimize my health. So the fact that that's just like out there and people are recognizing that makes me very happy. Um, but it's figuring out what that means, and obviously creating a plan where they're able to do that, and that they have a sense of how we're going to reduce that inflammation, I think is important. So I like to educate clients on that. Mostly as far as their kind of chief complaint or their major symptom that I see, it's usually digestive issues for sure.
oh, huh.
um, yeah, and or I would say skin manifestations would be probably the second most common.
Very
And
interesting.
yeah, so whether it's gas, bloating, constipation, diarrhea, and it's usually gas or bloating that they say, like after a
Hmm.
meal. The other thing is the highs and lows with their meals. So having those kind of crashes, or just feeling very distended after a meal and wanting to take a nap. So those spikes in insulin, that would be the other thing I'd say. Those are probably the
Interesting.
three most common.
I wouldn't have thought digestion. That's interesting. It makes
Yeah,
sense, but I just
yeah.
wouldn't have thought that.
Hmm.
Okay, so being that you're in the medical field, and there's like this expectation, and sometimes it's forced on you, through boards and et cetera, like doctors, where you have a certain scope of practice and you're not allowed to veer out of that. Like doctors can get in a lot of trouble if they don't stick with the recommended nutritional guidelines. If they do this bad diet stuff, they can
Right.
lose their jobs. Nurses too. How has that affected you? And if it has, how do you deal with it?
Yeah, so honestly, in I was working in with people with inflammatory conditions and in orthopedics and rheumatology. These were all, inflammation-based conditions, acute flare-ups, chronic, um, and I wasn't really able to say, well, what are you eating? Because I don't have that, as a PA. Like you would need to be a nutritionist, or it was a specific scope of practice. So even asking them about their lifestyle, it was more so, were you a runner? Or did you, like, activity level was emphasized, and then looking at their x-rays and focusing on that more objective data versus the individual themselves. So there is a fine line, and more so in terms of how to give advice about it. So yes, like even if I could ask them, well, has your diet changed at all? And they could say, yes, absolutely. It went from this to that, good or bad. I couldn't say, well, I recommend this diet. To say a diet would be a no-no. It was just, well, maybe you should consider looking into your diet, or maybe you should consider, if anything, it was consider weight loss. That's a very common one. And I'm sure other people can relate that, yes, their doctor or PA said you should lose weight, but they didn't tell me how to lose weight. Or they told me I should look into my diet, but they didn't tell me how to change it specifically. My dad had a health scare not too long ago, and I said, okay, so what did he say? And he said, well, just to eat healthier. And I said, and did he clarify what that meant? He said, no. I said, yeah, that's the line that is where you can't say much. So it definitely affects, how you can practice, and how you can help someone overall with their symptoms or with their condition, limiting you for sure. So that is kind of why I've resonated much more with a more functional approach to medicine in that space, because I believe that you can help people all around, including the diet and the lifestyle, and being able to speak on it for sure.
I like that. I was talking to one of the interviews I had, and the guy is a registered nurse that works in a hospital, and he would see continually, what the hospital food considers
Oh my God.
something decent for
Don't get me
diabetics and
started.
stuff. And he would just about lose his mind because he knew he had been through the whole spectrum, and he did so much research, and he knew, but yet within his scope of practice, he wasn't really allowed to say anything, but sometimes he just couldn't help it.
I
And
know.
he would just kind of try to mention something, and it was found out, and he was reprimanded and told that if he did it again, he could lose his job.
Oh,
So
wow.
he had to just sit back and watch this daily. And
Mm.
it is so incredibly upsetting to him, watching people lose their limbs and etc. And he's like, it's so
Yes.
unnecessary, but he can't say anything because it's, they're giving him all that excess carbs
Yeah.
or her, whatever,
Oh, it's
that
even
doesn't
in the fluids that they're giving you.
oh
You
yes.
know, like there's something to say for um, dextrose just in IV fluids versus just getting the saline, the salt, NaCl. Yeah, I mean, it's even in the IV fluids. And I understand these are people on, standard American diet where they are thriving on glucose. They're not fat fueled. So dextrose is their energy, but yeah, you see the meal of after even surgery and it's cookies and soda and it's really unbelievable. It's sad. It's very,
It's
very
hard to
sad.
watch. It's hard to watch
Yeah.
when you know better, and
Yes.
you're watching this and you can't do anything. He's so upset that he is trying to work his way out of his
Yes.
profession, trying to find a way to help people without being confined to, his scope of practice.
Yes.
And it's so sad, and I feel terrible for him because I can't imagine, having to keep your mouth shut when
Yeah.
you know you're doing damage to that person.
I
That's
know.
terrible. Just
No,
terrible.
that for me, yeah, was not resonating. And finding carnivore myself, I feel that, the two things kind of aligned in the sense that, yes, I'm a PA and I still want to help people. And that was my drive. That's always been my passion. But I want to help people in the right way. Doing that in a setting that allows me to do that. And with dietary consulting, it's just, like I said, the two have meshed. So I feel very lucky. But yeah, no, I can totally relate to that for sure.
Okay, so there's like, and I just got slammed for this, that what are my credentials? Why do I have the right to say anything? I'm just ignorant. I don't have this big fancy degree with a bunch of letters after my name.
Yeah.
What do you feel about that?
Yeah, so I mean, there are definitely people who are, registered dietitians or nutritionists or that do have credentials that are not that I do not. But I think experience is a much bigger part of that, and being able to lead people that way. I mean, you want the person who has been through it themselves personally. So I don't think big fancy letters are necessary. Like, yes, my background as a PA is helpful in the sense of kind of looking at symptoms and just being able to come up with other ideas. Even in my background in research, being able to experiment with people, but I don't have a PhD. It's so the letters, yes, they can be helpful and build trust in your clients, but I think the experience is much better in the sense of, who do you want to be led by? Do you want to be led by someone who has not ever experienced it themselves, but they read a book about it? Or do you want to be helped by someone who has been through it themselves and knows kind of the troubleshooting of tips and tricks? And that I would choose the person who's been through it themselves.
Yeah, and the thing is too, like, we were just talking about, there's certain scope of practice, you know, and
Yes.
and this, and I don't want to bash on nurses or dietitians because there's some really good ones,
Oh, no, for
but
sure.
you know, their training, who are they trained by? I
Yeah.
mean, you know, if you look at who has sponsored some of the training and the classes and the,
Absolutely. The
you know, that kind of,
conferences.
yeah, that, yeah, exactly. And you want me to take advice from them?
I know.
The
I mean,
advice that
being
I
a
did for 40
PA,
years?
I could go to, a conference that is all based on nutrition, saying that it was a PA nutrition conference.
Mhm.
Are they going to have talks about low carb and carnivore? Probably not.
Nah,
It's
nah.
going, like you said, the sponsored things about if your patient has high cholesterol, put them on a statin,
Yep.
things like that, where it's focus on fruits and vegetables and you're going to see the typical pyramid. And no,
Yep.
like, so even with the letters, or going to those big wig conferences, or this is the national this or that. No, I mean, that's why a lot of people are going to social media and doing their own research, or they're hiring
Yep.
a consultant or a coach, because again, I think experience is much more
Yeah.
telling.
I completely agree with that. And that is one of my biggest reasons why I didn't pursue a degree in nutrition, or, you know, to become a dietitian or something along those lines, because I don't want to be confined to that,
Yeah,
because I don't believe what they're teaching.
yeah,
That was not my experience. That did not help me. It hurt me bad.
yeah,
And so I cannot in good conscience turn around and preach that to somebody when I know it's wrong, or,
yeah,
you know, wrong for a majority of the people. I mean, I'm not saying one person might be okay with it, but
yeah.
generally speaking, I mean, look at the health of our country. It's terrible.
No, for sure.
So how has that advice helped? How have those guidelines helped? I
Yeah, no,
mean,
I think in the sense of diet and nutrition, Western medicine is not leading us on the right path.
nope.
Is there a place for Western medicine? Yes, for the person who is
Mhm.
having the heart attack, stroke, who needs
Mhm.
acute care in an emergency setting. Antibiotics they have, been beneficial for many reasons. But acute setting, Western medicine may be there, but if we can avoid those acute issues by changing the diet and the lifestyle, that would be, preventative medicine should be the backbone. Um,
Yes.
so I think it's more important for sure.
Yeah. Okay, so the last question, we're getting close on time.
Yeah.
It's a very personal question, and this is
Okay.
something that disturbed me greatly because I was going through some stuff just to kind of learn a little bit more about you.
I
And I
appreciate
came
that.
across some comments that really threw me and frustrated me, because I've seen other comments on some of my other guests, and it sickens me and it's frustrating. What
Yeah.
I saw was them talking about how unhealthy you look, and that obviously carnivore is not doing you any good. And are you really the best representation for carnivore because you don't look healthy? What's your
Yes.
response to that?
Yeah, so I have seen those comments. They do, sting a little bit, just for a second or two, but I don't let them get to me. I think, if you were to see someone, it's just as it's inappropriate to say that someone is obese. I think it's inappropriate to say that someone's too thin. Like, what is, you know, too, what is too fat? What is too skinny? But then, you have this normal looking person who is eating the processed foods and the seed oils and the grains, but they don't say anything to that person because that's okay. That's acceptable. So I try and keep that perspective that it's just a judgment. And that, we shouldn't judge, we kind. Also, that you never know someone's complete story. It really, like I said, everyone is on their health journey and they're at a different point in their health journey. I personally feel the best that I've ever felt, and on carnivore, and I do right now have goals to gain lean mass. But do I need to defend myself, or do I need to justify that to other people? No, not necessary. I just know in my heart that I'm doing the very best that I can, and I'm taking action, which is, I commend anybody who wants to take action and make their health a priority. So similar even to clients, I guess what comes to mind is similar to clients when they say, hey, I'm doing carnivore and my family and my friends, they're attacking me. Do you continue to do what is right for you? I always tell them to, if they are going to approach it, never to be defensive or to feel that they need to justify it. Just take it from the perspective of, or approach it from the perspective of, this was what makes me feel my best. Because then other people say, oh, well, you feel good. That's good. Like, I want you to feel good. People who care about you want you to feel good. So as long as you feel your best and, lead by example, that's all I can do. So in this space, I'm trying to get the education out there and just lead by example, help people in any way that I can for themselves, but also, I'm on my own personal journey and I have my own personal goals. And like I said, I feel the best that I've ever felt. So looks are something people can judge, but I don't let it affect me.
That's awesome. That's awesome. I'm going to have to really, work on a thicker skin.
Yeah, no, it is. It's having thick skin. And
woo, if I had those comments, I'd be like,
yeah, that's the thing. It's not being reactive. That's what you just have to keep in mind. Like, don't be reactive or feel that because you can easily get angered and want to defend it. And then people are going, oh, why are you getting so defensive? So it just creates more stir
drama,
chaos.
drama. Yeah.
Drama everywhere. Yeah. Exactly.
Well, kudos to you. I'm impressed.
Thank you. But it is what it is. I mean, especially putting yourself out there in social media.
Oh yeah.
There would be something. It would be that my hair isn't right or not the right color, or I'm wearing the wrong shirt. Like, something's going to be pulled apart. So
yeah. And the bigger you grow, the more I hear it happens. So,
Yep. No, I'm prepared. I'm prepared for sure.
Well, thank you so much for joining me, Austin. I've had a great time.
It's been a pleasure. Absolute pleasure.
Yeah, it was fun. Y'all subscribe to my channel and go follow Austin. Absolutely. I'll have all of her information below. So again, thank you so much, Austin.
Thank you. I've had such a good time speaking with you. Thank you.
Bye.
All right, take care.